Hello, my name is Kelly Biggs, and I'm a radiologist at Tyrone Hospital. I've been asked to talk to you a little bit about my field, so here we go. Pardon my poor lighting. As a radiologist, I'm responsible for medical imaging, and so our offices are by nature kind of dark. Well, first of all, what is radiology? Well, uh, it is a career for medical doctors. And as I just mentioned, it's largely centered around medical imaging. So you can see behind me several screens, and that's the first take-home point. If you're not a big fan of screens, this is not the right job for you. Uh, what I do is I receive images at my workstation that are acquired by technologists who actually take the x-rays, the CAT scans, the MRIs, perform the ultrasounds, all the different types of medical imaging out there. And I review those images and I make a diagnosis as to what's wrong with somebody based on how their insides look. So about 90% of my day is spent right here in this office looking at those images and interpreting them. I spend a less amount of time, but still a routine amount every week, doing some so-called interventional procedures, and that is where we use medical imaging to guide us to perform usually a biopsy on a patient. That is, we have an abnormality, we've picked it up on imaging, we want to find out what it's made out of, so we use imaging to guide us in placing a biopsy device in the body and taking a sample. I also will use imaging to place lines in the body for patients who need intravenous antibiotics or intravenous nutrition. I'll do aspirations of joints for people who have joint injuries or infections. In some cases, I'll actually inject medicine into joints for pain relief. That's fairly infrequent for me. Most of my work is diagnostic. But again, compared to some other doctors, I have a lot less direct patient contact. I do most of my work here in the office alone. That's basically what it's all about, and it takes a few years to get into a position like this. You'll have to get essentially 4 years of college, and after that, you'll have to do 4 years of medical school. And after that, you move into apprentice training called residency to specialize in whatever branch of medicine you decided to pursue. And that residency is a paid training position. It doesn't pay a whole lot, but at least you're not paying tuition anymore. And that may be as little as 3 years for some of the general practice type specialties, and can go up to 7 years or sometimes more for some other specialized fields. When I finished my training about 11 years ago, I did a 5-year residency program. Most radiologists now do about 6 years of training, with residency followed by a thing called a fellowship, which is just further subspecialty training. So I'm a general radiologist, and that's why I work in a rural central Pennsylvania hospital, because places like these, you need radiologists who can read all sorts of different type of imaging, different body parts, and perform some interventional procedures. At a larger academic center, big city hospital, they may have high enough volume where they need more radiologists who specialize in, say, one type of body system. So you do have that diversity in your field. Some radiologists do entirely spend their day doing interventional procedures, whereas that's a small part of my job. It's their entire job. That's basically the field, and I'm going to now review some questions that were given to me that your institutions have asked us to answer, and we'll go through those now. First question is, how did you decide to enter your profession? Well, this is my second career. I was a Navy pilot first and moved into medicine later. And It's kind of complex how I got there. I'd say in no small part when I was young, my toddler son was diagnosed with autism, and that was the first impetus for me to move away from the Navy and into medicine. Have I always worked in this field is the next question, and already answered that. Nope, was in the Navy in the past, and now I'm a civilian doctor. Next question, what kind of experiences and high school subjects would be helpful to someone thinking about a career in my field? Well, you've got to have a healthy dose of sciences. It's good to get that foundation of chemistry and biology in high school if you can, because you're going to need those for the entrance examinations, and you'll need it to meet the minimum requirements for medical school. That said, you shouldn't be intimidated by the science-rich curriculum. And there's no obligation to have a science-type major when you go to college in order to go into medical school. I was actually a history major. I went to a college that still required a lot of science courses regardless of your major, and so most of my requirements I had met, even though I didn't have a science major. But I would also say that you shouldn't consider this a job that's only available to the super genius. You do have to do well in school, but you don't have to, be the valedictorian of your high school. And if your grades weren't tremendous in high school, or even in parts of college, you can make up for that by volunteer work, by showing your aptitude in medicine on entrance examinations and other avenues. So if this is something you really want to do, you shouldn't consider a career that's limited to the A+ only student. Next question, what do you enjoy most about your job? I enjoy the fact that my job is centered around helping people. That's kind of a cliche that you'll see mentioned quite a bit by people in the medical community, but nonetheless it's true. If nothing else, when I go to bed at night, I can feel like, hey, the bulk of my work is centered around trying to make people better, or at least find out what's wrong with them so that somebody else can help them be better. What do I like least about my job? Well, something that for any career in medicine, most careers in medicine, I should say, you should consider is it is a long haul to get past training and get into the driver's seat. And secondly, this is a job that's always on. So even though I have working hours and I go home at the end of the day, especially being in this rural environment where I'm the only radiologist in the hospital, the images are still being acquired at night and on weekends and on holidays. And if you're in medicine, you can expect to do some work outside normal business hours just because people get sick at inconvenient times. But that can wear on you if you never completely escape the job. And sometimes some of us are never completely off duty. What is the projected need for new workers in this field in 5 and in 10 years? There is a significant demand for radiologists. It was particularly high before the pandemic started. It's decreased a little, but I expect that to recover as we move post-pandemic. I think the biggest threat to our career is the maturity of artificial intelligence. There are already computer programs that can do some simplistic reading of medical imaging. It's not anywhere near replacing radiologists, and some will argue that it will never replace radiologists, but it will undoubtedly change the nature of our job, and we're not quite sure how that's going to look in 10 years, for example. But otherwise, the career field seems to be promising and wide open. Next question. Are there any volunteer or paid work experiences in my field which high school students can engage in. Not so much in the paid realm, but you can certainly volunteer. And in fact, when it comes time for you to go to apply for medical school, the medical schools are going to look for some evidence that you've done some volunteer work. We routinely host high school students at Tyrone Hospital, so you have an opportunity to observe and decide whether this career is right for you. And I encourage you to do so. And if not now, then try to do it in college, because you will need, as I said, to show more than just your grades. You'll need to show that you're showing some interest in the medical field and have some experience with it. If you have any questions about this field, don't hesitate to contact me. The best way is to reach me by email, and that's at kbiggs9105@gmail.com. Again, that's K as in Kilo, B as in Bravo, IGGS 9105@gmail.com. Happy to talk to you. And I think that's the end of the questions. It is. And thanks if you've made it to the end for listening. Have a good day.